The Wuhan virus is back to haunt us. A new subvariant has India worried, and rightfully so. Cases are rising. The central government has issued an advisory. States have been asked to stay alert. It is 9 p.m. IST on the 18th of December, and I'm afraid I'm bringing you bad news because the Wuhan virus is back. In an advisory to Indian states, the Ministry of Health and Family Welfare has said, and I'm quoting, recently a few states, union territories, like Kerala, have reported a slight upsurge in Covid-19 cases. It goes on to say that considering the upcoming festive season, there is a need to put in place requisite public health measures and other arrangements to minimize risk of a rise in transmission of this disease. Indian states have been asked, or rather advised, to ensure that there is adequate testing in place. They also have been told to send positive samples for genome sequencing. States have also been asked to report cases of influenza-like illness and severe acute respiratory illness. Here's something else that the central government has asked states to do. Engage all public and private healthcare facilities in the preparedness and response drills. You see, there have been at least 127 new infections in the last 24 hours, which has taken the active caseload to 1,828. This comes on the heels of a new subvariant that has been detected in the country. It is called JN.1. So what do we know about this new subvariant? The variation is believed to have been first detected in Luxembourg. According to the Centers for Disease Control and Prevention, there is no indication of an increased severity from JN.1. But the subvariant has driven a significant rise in cases. Currently, cases of the JN.1 have been reported in several countries in the West and also in China. In the United States, it makes up 15 to 29% of all cases. Singapore is also battling a rise in cases. In fact, there has been a jump of about 24,000 cases in a week. Now, I'm talking about the period between December 3rd and 9th. Hospitalization is up. People have been told to wear a mask. In Singapore, the total number of cases have crossed 56,000. I repeat, 56,000. And all these cases are believed to have stemmed from the JN.1 subvariant. The next question: what are the symptoms of this subvariant? Experts say the symptoms are not too different from that of other strains. These include fever, a runny nose, a headache. Look around you. You'll probably see several people complaining of these symptoms, and that is a cause of concern. In India, the first case of the JN.1 was reported in Kerala. The patient is a 78-year-old woman. She reportedly had mild influenza-like symptoms. And now in neighbouring Karnataka, the government has made mask wearing compulsory for all those who are above the age of 60 and those with underlying comorbidities. Some more facts. The government has also asked those with symptoms of a cough, any phlegm and fever to wear a mask. So what should you be doing? For one, be vigilant. Keep an eye out for any kind of symptoms. I've mentioned the symptoms already. And please, get on a call with your doctor the moment you feel unwell. Isolate yourself if that is possible. And if you haven't taken your COVID-19 vaccine yet, it's high time you do so. It's imperative that you do so. WION World is now available in your country. Download the app now and get all the news updates on the move.